what has the role of the BRICS alliance been during the COVID-19 pandemic? The world continues to battle the impact of the virus, and BRICS countries are some of the most affected. So how have we responded to the pandemic? What lessons can we learn from each other? And more importantly, how can we collaborate to mitigate the impact of the virus? Let's chat to Dr. Emmanuel Matambo from the Center for Africa-China Studies at the University of Johannesburg. Dr. Matambo, thank you so much for your time on The Lead this afternoon. The BRICS countries have about 3 billion people. The countries are some of the most affected by the global pandemic. How have the countries actually handled this pandemic so far?
First of all, good afternoon to your audience, and thank you for inviting me. As you have rightly put it, to put it in perspective, the BRICS countries amongst themselves share an aggregate global population of about 42% of the entire globe, and they have been adversely affected, unfortunately, by the COVID-19. Now, what is even more daunting for them, especially India and Brazil, is that Brazil is only second to the United States in terms of the death toll of coronavirus. India's death toll has been growing alarmingly. And in the aspect of India, it is actually worse because the Serum Institute is the biggest vaccine manufacturing plant on earth, and it has been beset by a lot of problems, unfortunately, because India, after the exponential growth of coronavirus cases and deaths, the Serum Institute decided to stop exporting its vaccines, and even today, out of the 200 million doses that it should export through COVAX, has only managed about 20 million. So those are just the cheerleading statistics that are besetting the BRICS countries.
What can we learn from each other, Dr. Matambo? I think we've all fallen short in one way or the other at some point. I mean, in China, there's been criticism that the country didn't communicate well enough in the beginning of the pandemic. In Brazil, we had the president there who denied the existence of the virus. In Russia, the country was criticized for approving a vaccine soon enough when it didn't go through all the right processes. And in India, there were political rallies, some of which were addressed by the president, which have led to a spike in infections. And when you come here on home soil, we are way behind with our vaccine rollout program.
What we can learn from this is synergy, and the world is interlinked in such a way that we cannot attack global pandemics or global crises independently. Now, in 2018, at the 10th BRICS Summit here in South Africa, the BRICS countries agreed that they were going to form a BRICS vaccine research initiative. Last year, at the 12th summit of the BRICS, and the Moscow Declaration in Russia said that the BRICS countries had to work in a coordinated and a prompt way. But that unfortunately has not happened, and it is because the BRICS itself is fragmented. If you look at Brazil, as you have rightly put it, President Jair Bolsonaro has not deferred to scientific reason, and not only that, he has treated this pandemic as a political issue in much the same way that Donald Trump did. South Africa hasn't shown its leadership on the African continent. It is behind countries, more populated countries such as Ethiopia and Egypt, for example. So if the BRICS countries were to work in synergy, then we would see that the coronavirus pandemic was going to be contained somewhat. Because to tell you the truth, another uplifting statistic from the BRICS that has not, unfortunately, helped the emerging countries, even the BRICS countries themselves, that about half of the vaccines actually come from the BRICS countries. China has about 6 vaccines, Russia and India each 2 vaccines, but then they have not worked in a coordinated manner, even in a manner that can actually demonstrate some candor between themselves. For example, who amongst the BRICS countries is telling Brazil to be more responsive? None is doing so, and that has actually been to the detriment not only of the BRICS countries, but the emerging world at large.
How has this changed our relations, Dr. Matambo? Because China, as you indicate, they have a vaccine, so is Russia. I think Russia, in fact, wanted to donate some 5 million doses in the beginning, and reports are suggesting that we said no to that because of uncertainty over its efficacy. But it's now emerging that government wants to buy the same vaccines now at about 600 million rand. How are we doing in terms of vaccine sharing, knowledge sharing, and just helping one another and cooperating?
Not so good. That is the most definite answer. We're not doing so good because our approach has not been coordinated. South Africa, for example, should decide exactly where it wants to procure most of its vaccines. And this is a lesson not only for the coronavirus pandemic, but even for things that might happen in the future, because this has shown that declarations without implementations will only actually exacerbate the spread of pandemics such as the coronavirus, and not only pandemics, by the way, even other crises such as climate change and the spread of terrorism and extremism, because the approach of the BRICS countries as the countries as the leading countries of the emerging world has been fragmented, and most of it has just been haphazard, with each country trying to do as it wants. I would have wanted to see more of what India and South Africa did late last year when they applied for a patent waiver, and we have seen that the Biden administration in the United States is almost easing towards that particular proposal. So we would like to see more of that coordination amongst the BRICS countries and the developing world, and speaking at one voice, because we cannot expect that the developed world, those whose current approach to the coronavirus is favored, would actually do more to improve the prospects of the developing world. Because we see countries like Canada, for example, that order 6 times more of the vaccines that they need. And the Canada, the United Kingdom, Japan, and the US, these are countries that account for only 13% of the global population. Yet we have seen them gouge about 50% of the global doses that are available. So if the developing world under the BRICS umbrella could work in concert, then we could see a more just world in terms of vaccine distribution across the globe.